Well, thank you, Chippo, for that beautiful introduction, and to all of you for the chance to be here today. I just wanted to thank a few people, John Tiedstrom and David Alport and Brian Learney and GBCHealth in general for the chance to be here. If I could have the first slide, great. I want to talk about the power of lifestyle changes and love in affecting our health and our well-being. You know, we tend to think of advances in medicine as being a new drug or a new laser, something really high-tech and expensive. And we often have a hard time believing that the simple choices that we make in our lives each day, like what we eat, how we respond to stress, how much exercise we get, and perhaps most importantly, how much love and support we have in our lives, that these simple changes can make such a powerful difference, but they do. And in our work, we've used these very high-tech, expensive, state-of-the-art measures to prove how powerful these very simple and low-tech and low-cost and often ancient interventions can be. But if you had to boil it down to one phrase, it would be, if you can address the underlying cause of what causes these chronic diseases, then what we find is that our bodies have a remarkable capacity to begin healing themselves, and much more quickly than we had once realized. I got interested in doing this work when I was a medical student, and I was learning how to do bypass surgery with Michael DeBakey, the heart surgeon. We'd cut people open, we'd bypass their blocked arteries, he'd tell them they were cured, and they'd more often than not go home and do the same things that had caused the problem in the first place. Eat junk food, smoke, not manage stress, not exercise. And so then we'd cut them open again, sometimes 2 or 3 times. And so for me, that became a metaphor of an incomplete approach, that sometimes you do need to mop up the floor, but we also need to treat the cause by turning off the faucet. And when we do that, our bodies can begin to heal because these processes are so much more dynamic than we once realized. And in this context, lifestyle isn't just prevention, it's also treatment that can work as well as drugs and surgery, sometimes even better, and the only side effects are good ones. And all these things were thought impossible just a few years ago when we began doing this work 35 years ago, and now it's become part of the mainstream. We started with heart disease, as Chippo mentioned, and we did a series of studies culminating in what was called the Lifestyle Heart Trial, and we used measures of how much blockage there were in the arteries that feed the heart. And you can see in the upper left, there's a narrowing there where the arrow is because the artery that feeds the heart is clogged, and so the heart becomes starved for the blood and the oxygen that it carries. But a year later, it's wider. And then in the PET scans down on the below, blue and black at the lower left at the beginning is no blood flow. A year later, in the lower right, orange and white is maximal blood flow. Overall, we found that the patients got worse and worse from beginning to 1 year to 5 years in the control group who weren't making these changes. They were making only moderate ones. But the people who made more intensive changes showed some reversal in the amount of blockage in their arteries after a year, and even more improvement after 5 years. I want to show you just a 1-minute video clip of one of the patients who went through our program in West Virginia to put a human face on this.
I'm no longer using a cane or a wheelchair.
Can you turn it up, please?
In November of 2001, I was using a cane to walk with, and I had to have the humiliating experience of riding a wheelchair around Walmart.
Uh-oh, what happened here?
Now, I didn't like that. I wasn't going to settle for that. I knew there must be a better way. And thank God I found a better way. I no longer have to take my diabetes medication. In fact, my total medication has been reduced by 75%. I had trouble getting to my mailbox without having chest pain. But now I'm walking at least 2 miles a day. I ride my stationary bike anywhere from 8 to 10 miles a day.
Now, this is not a best case. This is representative of what happens when people make these changes. That's why I'm so passionate about doing this work, because people get better, and they get a lot better, and it's something that stays with them. They continue to improve over time. One of the interesting findings was that the more people change their lifestyle, the more they improve in ways we can measure. We found that with the amount of blockages in the arteries. We found it later with everything we looked at. The more you change, the more you improve. And that's a profoundly encouraging and optimistic view, because it's saying, well, there's no guarantees for most people. The more you change your diet and lifestyle, the better you feel, and the more you improve in ways we can measure. So then we looked at prostate cancer, and we did this study in collaboration with the chair of urology at UCSF and the late chair of urology here in New York at Memorial Sloan Kettering Cancer Center. We took men who had biopsy-proven prostate cancer and who had elected not to be treated conventionally, so we could randomly divide them into two groups, ask one to make intensive lifestyle changes but not the other, and then look at the effects of these changes without being confounded by the usual chemo and radiation and surgery. And what we found after a year is that the PSA levels, a marker for prostate cancer, went up or got worse in the control group, but went down or got better in the experimental group. Again, the more people changed their lifestyle, the lower their PSA went. But we wondered, maybe we were just affecting PSA, maybe we weren't really affecting the prostate tumor. And when we looked at the tumor growth in vitro, we found that the tumor growth was inhibited 70% in the group that made these changes compared to only 9% in the control group. And here again, the more people changed their diet and lifestyle, the more it directly inhibited the growth of the prostate cancer. And we used a new test called MR spectroscopy that measures the tumor activity, and it's shown in red here. And you can see it began to shrink during that year, as well as the PSA coming down. So this is the first and still the only randomized controlled trial showing that the progression of prostate cancer can be stopped or even reversed simply by making lifestyle changes. The same lifestyle changes that can reverse heart disease can also stop or reverse the progression of prostate cancer. So we wondered, what are some of the mechanisms by which this can occur? What happens to your genes? And what we found was that in just 3 months in men with prostate cancer, over 500 genes were changed. And in fact, turning on the good genes that prevent disease, turning off the genes that promote cancer, heart disease, and breast and prostate and colon cancer. They were turned off. And you can see here what's called a heat map. On the left, it's mostly red. Down the column on the far right, these are all different genes that promote cancer. Red is turned on, green is turned off. You can see how it goes from mostly red to mostly green in just 3 months. We also did a study with Dr. Elizabeth Blackburn, who was awarded the Nobel Prize in 2009 for discovering telomerase. And telomerase is an enzyme that repairs and lengthens our telomeres, which are the ends of our chromosomes that control how long we live. As your telomeres get shorter, your life gets shorter. And she had done a study that found that women who were under chronic stress, their telomeres got shorter. The first study showing that chronic stress can actually shorten your lifespan. So we were presenting at a conference together once, and I said, you know, if bad things can make your telomeres shorter, maybe good things can make them longer. And we found that sure enough, after just 3 months, the telomerase increased by 30%. And this is still the only intervention that's shown that. And then we followed those same patients for 5 years, and we're about to publish a new study showing that the telomere length itself, after 5 years, got longer in the group that made these changes, but got shorter in the control group. And here again, the more people change their lifestyle, the longer their telomeres work. And this is the only intervention that's been shown to do it. And it's the same intervention that was shown to reverse heart disease, prostate cancer, and later you'll see diabetes as well. Now, that's really a powerful message to give people, because so often I hear people say, oh, it's all in my genes, what can I do? Well, it turns out you can do a lot, because our genes are our predisposition, but our genes are not our fate. We're also about to publish the first study showing that you can change angiogenesis. When a tumor grows, it secretes substances that cause blood vessels to grow to feed the tumor. It's called angiogenesis. And there are very expensive new drugs like Avastin and Nexavar that are anti-angiogenesis drugs. So we did a study with Dr. Will Lee, who's head of the Angiogenesis Foundation, and we just found, just as of a month ago, that VEGF, which is one of the substances that that a tumor secretes to grow new blood vessels, was downregulated. So red is the control group, blue is the group that made these lifestyle changes. So you can turn off the factors that cause blood vessels to grow to feed the tumor and therefore starve the tumor of that blood supply. Now, this being a global health conference, one of the passions that I've had for many years is this, what I term this globalization of chronic disease. And we've heard about this from the First Lady and the Minister from South Africa and others here, that other countries are starting to eat like us and live like us and die like us all too often. You know, heart disease and type 2 diabetes are killing more people around the planet than than AIDS and TB and malaria combined. And what's happening is it's diverting precious resources away from diseases that really do require drug treatments, like AIDS, TB, and malaria, to diseases that can largely be prevented and even reversed simply by changing diet and lifestyle. And what kind of diet is that? It's a third world diet. I mean, this is the way that people eat who generally haven't had the prosperity and the technology to eat the way that Americans have been eating. And so Fruits and vegetables and whole grains and legumes and soy products are really some of the, except for the fact that they're the perverse incentives of the agriculture subsidies, these should be the cheapest ways of eating. You need a pair of walking shoes, you need a yoga mat, you don't require any special equipment. These are things that can be done anywhere in the world. And intervention now, it's kind of like AIDS in the early 80s, can make a powerful difference. We're on the steep part of that curve. Now, what's personally sustainable is globally sustainable, and what's good for you is good for the planet. We often have these false choices. You know, am I going to look out for myself or am I going to help other people? It turns out you can do both at the same time here. You don't have to make these painful choices. And what do I mean by that? Well, we're currently dealing with three major crises, as you know, with an energy crisis, a global warming crisis, and a health crisis. And they all converge on what we eat and how we live. And it's so easy to feel overwhelmed, like what can one person do, right? Except all of you know what one person can do because you wouldn't be here otherwise. But the food choices that we make each day impact all of those. Let's take the energy crisis. It turns out that 20% of the fossil fuel that we burn goes to produce processed foods. So we waste a lot of energy doing that. And when you're eating meat, you're eating much higher in the food chain. It takes 10 times more energy to produce an equivalent amount of protein than when you're eating lower on plant-based protein. It also, a quarter pounder, Michael Pollan calculated that a quarter pounder with cheese takes 26 ounces of petroleum and leaves a 13-pound carbon footprint, which is equivalent to burning 7 pounds of coal. Now, from a global warming standpoint, many people are surprised to hear that livestock consumption accounts for more global warming than all forms of transportation combined. You know, it's responsible for 18% of the world's total greenhouse gas emissions compared to only 13% for the entire global transportation network. So what you eat affects global warming every day. And from a health standpoint, it turns out that 3/4 of the $2.7 trillion in healthcare costs, which are really sick care costs, are due to chronic diseases that can be largely prevented or even reversed simply by changing diet and lifestyle. Now, one study, this is called the EPIC study, one of the AMA's lead journals, showed that just moderate changes, just walking a half hour a day, eating a reasonably healthy diet, keeping a reasonably healthy weight, prevented 93% of diabetes, 81% of heart attacks, and 1/3 of cancers. Now, if type 2 diabetes is going to affect half of Americans and pre-diabetes in the next 8 years, and we've already heard about globally in South Africa and the rest of the world how big diabetes is, and it can be completely prevented today for virtually everybody. And the same is true for heart disease. The Inner Heart study looked at on all 7 continents, found that in 30,000 men and women, at least 95% of heart disease is completely preventable today. We don't need a new breakthrough. We just need to put into practice what we already know. Now think about it. It's mind-boggling. The disease that kills heart and blood vessel diseases kill more people than virtually everything else combined, and it's completely preventable today if we simply put into practice what we already know. Now, how do we treat heart disease? We treat it mainly with drugs and surgery in this country. Now, that would be great. We spent $60 billion on angioplasties and $40 billion on bypass surgery last year. That's $100 billion, which you say, well, that's a lot of money, but it's probably worth it because it saves a lot of lives, except it doesn't. The randomized trials have shown very clearly, including this one in the New England Journal of Medicine, a more recent meta-analysis of 8 randomized trials, including this one. What was the conclusion? They don't prevent heart attacks, they don't prolong life, and they don't even reduce angina more than medications do. So if we were really practicing evidence-based medicine, there'd be a fall-off in the number of angioplasties that were done, but they're doing more than ever because it's reimbursable, and that's part of the problem. The cartoon says, I can operate or you can go on a strict diet, and the patient says, well, you better operate, my insurance doesn't cover a strict diet, and that's been the primary determinant of medical care is reimbursement. With all this talk about evidence-based medicine, more often it's reimbursement-driven. And so the same is true for bypass surgery. When I was learning how to do bypass surgery, Dr. DeBakey wouldn't even participate in randomized trials. He was so convinced that it helped, and yet all the randomized trials, including the most recent one in the New England Journal of Medicine, show that they don't work either. Unless you have the most severe disease, you're in the middle of having a heart attack, angioplasties and bypasses really don't do much. They're dangerous, invasive, expensive, and largely ineffective. Now, what about prostate cancer? Prostate cancer, other than skin cancer, is the #1 cancer in men. And it turns out that what usually happens, a guy gets his PSA checked, it's going up, they do a biopsy, they find they have prostate cancer, and they say, wow, it's really good we found it, we caught it before it spreads, now let's cut it out, or let's nuke it, and let's get rid of it, and you're saved. Except that's not what the data show. The data show that, this is also in the New England Journal of Medicine last year, that only 1 out of 49 men who's treated for prostate cancer actually lives longer because of it. 1 out of 49. The other 48 generally become either impotent or incontinent or both. And so you're taking a guy who's at the prime of his life, usually men in their 50s or early 60s, scare the hell out of them, tell them they need to have this procedure done, the surgery done, which often maims them in the most personal ways. So now they're wearing diapers and can't have sex, and before they were just fine, for no real benefit. And so the U.S. Preventive Services Task Force a few months ago said maybe we shouldn't even screen men for prostate cancer because there's such intense pressure to get treated and the treatments don't really help most people. Maybe it's better just not to know. It's like hear no evil, see no evil. Well, that's not right either. There's a third alternative, which is if we can stop or reverse the progression of early-stage prostate cancer through the same diet and lifestyle program that can reverse heart disease and diabetes and other chronic diseases, that's a better approach. In fact, Dr. Peter Carroll, the chair of urology at UCSF, who collaborated with me on these studies, he's one of the busiest surgeons in the country, but he also has the largest sample of what are called active surveillance or watchful waiting patients, because he has great credibility. He says, I can operate on you, but you don't need it. Most people don't need it. They can track them, follow them closely, give them an aggressive, non-surgical, non-pharmacologic lifestyle intervention, and then help to identify that 1 out of 49 people who really needs the surgery and operate just on that person and leave the other 48 alone, which will save a huge amount of money as well as a lot of personal suffering. And as I mentioned before, United Healthcare came out with a report earlier this year that half of Americans will be diabetic or pre-diabetic in the next 8 years at a cost of over $3 trillion for a disease that's completely preventable for most people simply by changing diet and lifestyle. It's not sustainable. So we have this debate going on between many in Washington saying, many on the Democratic side say, let's just raise taxes, let the deficit go up. Many Republicans saying, let's just privatize or demolish or dismantle Medicare. Again, not good choices, so there's not much agreement there. But there's a third alternative. If we can treat the underlying cause, if we turn off the faucet around the sink that's overflowing, we can make better health available to more people at lower cost, and the only side effects are good ones. Now, with diabetes, it turns out that lifestyle changes are better than drugs at preventing diabetes. This was from the New England Journal of Medicine also, the Diabetes Prevention Program. They looked at placebo, a drug, and lifestyle, and not even intensive lifestyle, just moderate lifestyle was better than the drugs at preventing diabetes. In terms of treating diabetes, last year the New England Journal also published 2 studies showing that lifestyle changes work better than drugs at treating diabetes. The 2 drugs that controlled the blood sugar, but they didn't prevent all the horrible complications of type 2 diabetes. And the editorial that accompanied it said, for now, let's just focus on lifestyle, not so much on drugs. And coming out in the New England Journal of Medicine, that says a lot. Now, it turns out that the healthcare costs are huge in diabetes. Instead of an average of $4,400 for the year, it's almost $12,000 if you have regular diabetes and over $20,000 if you have complicated diabetes. So in the first year, the program can pay for itself, any lifestyle program. And the complications of diabetes are awful. You know, heart disease, blindness, amputations, kidney failure, impotence, and so on. And they're completely preventable. The insurance will pay for the amputation, but it won't pay until recently for the lifestyle changes to prevent that. That's now changing finally, and it's about time. It turns out if you can get your blood sugar down, you can prevent all of these complications. And hemoglobin A1C is just an average blood sugar over the last 3 months. If you get it down below 7, you can prevent all these complications. Not if you do it with drugs, but if you do it with lifestyle. And we've trained now 51 hospitals and clinics around the country, including 24 in Nebraska, Pennsylvania, and West Virginia that Highmark Blue Cross Blue Shield has been doing. And we showed that in almost 1,000 people that we could get their blood sugars down below the level so we can prevent all these complications and costs, both the human costs and the economic costs of type 2 diabetes. We've done 3 demonstration projects. The first one was with Mutual of Omaha, where we found that almost 80% of the people who were told they needed to have a bypass or an angioplasty could safely avoid it by simply changing their diet and lifestyle. And they found they saved almost $30,000 per patient in the first year. Now, there's this running debate going on in Washington. Does prevention really save money, or is it just delay costs? Well, that's a running debate. But when lifestyle is treatment, it clearly saves money in the first year in approaches that are much less invasive and much more compassionate. Now, with Highmark, we looked at 3,000 men and women. We actually have close to 4,000 now in these 3 states. West Virginia, by the way, is #1 in the country in heart disease. It's like if I can make it there, I can make it anywhere. 46% had heart disease, 1/3 had type 2 diabetes, 80% had high cholesterol, 74% had high blood pressure, and 70% were overweight. We found that the 85 to 90% adherence after a year in all 51 of these hospitals. Okay, 85 to 90% adherence. That's unprecedented. And I'll talk about why it is that we've been able to do that. First of all, people feel better. Almost all the patients reported significant improvements in their chest pain, those who had it. I'm going to show you just quickly a series of slides beginning 12 weeks, 1 year. A 16-pound weight loss that was sustainable. The ability to exercise went up and stayed up. The depression scores were cut in half. This is better than you get with antidepressants without the costs and the side effects. Hostility went way down, which is one of the most toxic emotions for your heart. You know, the old joke, am I going to live longer? Is it just going to seem longer if I change my lifestyle? It turns out your quality of life improves dramatically when you make these changes as well. Systolic blood pressure goes down. Diastolic blood pressure goes down. When you get put on blood pressure medicine or diabetes medications or these other drugs, what do they tell you? You say, doctor, how long do I have to take these pills? What's the answer? Forever, right? It's like, how long do I have to keep mopping up this floor? Forever. Well, why don't I just turn off the faucet? It's the same idea here. When we treat the cause, in every way we measure, your body begins to heal. We get people off of their medications. We get them away from the surgery that they otherwise might have needed at a fraction of the cost. And as I mentioned, the only side effects are good ones. Their diabetes, their blood sugars come down to a normal or near normal range. Now, from a cost standpoint, Highmark did a study where they found, with their head of informatics, who was very skeptical of this whole idea, found they cut their costs in half in the first year and by an additional 20 to 30% in years 2 and 3. So you can imagine if we have the $2.7 trillion in healthcare costs and we could cut them in half in the first year, that would free up an awful lot of resources to do other stuff. And as Chippo mentioned, after 16 years of going back and forth with Medicare, Medicare is now paying for our program, which was a huge breakthrough because, you know, reimbursement is the primary determinant of medical practice. We've changed reimbursement, you changed medical practice, and even medical education. It's the first time that Medicare has covered lifestyle as a treatment. And again, if it's not reimbursable, it's not sustainable. So we're very grateful to them for doing that. And these are reaching a tipping point, and many of you are dealing with large corporations and so on. It used to be at the human resources level. Now it's at the CEO level. Howard Schultz said we spend more money on healthcare for our employees than we do for coffee beans. Mars spends more money for healthcare than they do for sugar. General Motors more for healthcare than for steel. It's a lot. So in 2005, Steve Bird, the CEO of Safeway, approached me, and he said, you know, we're spending 120% of our net revenues for healthcare for our employees. That's not sustainable in any business. They tried the managed care approach. It just led to a $1 billion strike. So I said, well, why don't we put on the worksite many of these same ideas? And he's a very visionary guy, and they did. And they found their healthcare costs, again, because these biological mechanisms are so dynamic, you can see the economic savings in the first year, and their costs have remained relatively flat compared to the rest of the population. It's my understanding that he'll be honored here later this week. We also trained the St. Vincent de Paul homeless shelter in San Francisco in our program. We now have over 15,000 homeless people who've gone through it. And again, if homeless people can make lifestyle changes, I think anybody can. And we found that we're now teaching them the reversing heart disease program. The Medicare reimbursement will provide not only for the reimbursement of the heart disease, but the other non-reimbursable programs, so we can create a sustainable model that isn't dependent on ongoing philanthropy. And then we'll be cloning this to other St. Vincent de Paul homeless shelters throughout the country and ultimately throughout the world. Now, what is it that enables people to make and maintain these changes? And it's not what I thought when I began doing this work. It's not fear of dying, it's joy of living. That fun and freedom and pleasure and love are really what are sustainable. If it feels good, people will do it. But most of the time, we try to scare people into changing, and that doesn't work. And also, people want to feel free and in control. And if you go on a diet, or diets are all about what you can't have and what you must do, and it's, you know, eat this and don't eat that and do this and don't do that, and people do it for a while and they get off and then they feel more shame and guilt and humiliation and all these toxic emotions that really are not helpful. And so what I realized is that instead of making it all or nothing, that we have a spectrum of choices, that the whole concept of risk factor reduction is based on fear, and fear is not a sustainable motivator. If, you know, the idea that taking a pill is easy and everyone will do it, but changing diet and lifestyle is difficult if not impossible is really not true. Only about 1/3 of people who were prescribed Lipitor and the other statin drugs were taking them after just 3 or 4 months. Just 1/3, even if someone else is paying for it, even if there are no side effects from it. And you say, well, why is that? Because they're fear-based. Take this pill today that doesn't make you feel better to prevent something really awful like a heart attack or a stroke that you don't want to think about, so you don't, and so people stop taking it. But when people change their lifestyle, most people find they feel so much better so quickly. It is sustainable, not out of fear of dying, but as I mentioned, out of joy of living. And this goes all the way back to the first dietary intervention, you know, when God said, don't eat the apple, and that didn't work, and that was God talking, so we're not going to do better than that. And I like this cartoon. The fortune teller says, I give smokers a discount because there's not as much to tell. That's the fear-based approach that doesn't work very well. And if you tell teenagers that smoking is dangerous, that just makes it cool. It's like, you know, riding a Harley, you know, like James Dean on a Harley. So that doesn't work very well either. And Christy Turlington, who spoke here earlier today, has this wonderful website called smokingisugly.com because nicotine, her father died of lung cancer, and nicotine makes your arteries constrict. That's why in your heart it can cause a heart attack, or your brain it can cause a stroke. But in your sexual organs, it can cause impotence, and in your face, it causes the little capillaries that feed your face to constrict, and so you get wrinkled, and you age, and you have that great pallor. And so smoking doesn't make you beautiful, it makes you ugly. And this was one of the most effective anti-smoking ad campaigns that the Department of Health Services did in California. It doesn't say emphysema, heart attack, lung cancer. You know, they have all these pictures now in the UK of people with half their faces removed and tracheotomies. That doesn't work. Fear doesn't work. But if you tell somebody it's too far in the future, you know, the mortality rate is still 100%. It's one per person. We're not going to change that. And so efforts to try to scare people into changing don't work, at least not for long. After they've had a heart attack, maybe for a month they'll do it. Even then, they stop. But if you tell people, instead of saying it's dangerous, if you say it makes you, instead of saying it makes you sexy and beautiful, it makes you ugly and impotent, that puts it right into the here and now, and it's much more effective. It's the anti-Viagra. It is, you know, because half of guys who smoke are impotent. And so again, the primary determinant was how much people change. The more you change, the more you improve, but also the more you change, the better you feel. The better you feel, the more you want to keep doing it, because there's no point in giving up something that you like unless you get something back that's better and quickly. And because these mechanisms are so dynamic, you feel the benefits very quickly. And so the spectrum idea is based, instead of saying it's all or nothing and saying do this and don't do that, to say, look, what matters most is your overall way of eating and living. So if you indulge yourself one day, it doesn't mean you cheated or you're bad or you failed, you know, just eat healthier the next. You know, if you don't exercise one day, do a little more the next. If you don't have time to meditate for an hour, do it for a minute. Whatever you do, the more you do it, the more you improve in how you feel, and the more you improve. And then you get into these virtuous cycles as you start to feel better. It's like, oh, when I do this, I feel good. When I don't do this, I don't feel as good, so maybe I'll do more of this and less of that. And then it comes out of your own experience, not because some doctor or some book told you. So it's really not about, and if I tell you what you should be doing, there's automatic pushback. But if you decide how much you want to change, then we support that degree of change. And instead of saying these are good foods and these are bad foods, just say I've categorized foods from the most helpful to the least helpful. To the degree you move in that direction, there's a corresponding benefit. And then we'll support that and we'll track it. And if that's enough to accomplish your goals, great. If not, you can do more. I'm just going to show you just a 1-minute clip about this. The last thing I want to talk about, and perhaps the most important, is that the epidemic that I'm most concerned about isn't just heart disease or cancer or diabetes, it's loneliness and depression. You know, there's been a breakdown of the social networks that used to give people a sense of connection and community. And that need for connection and community is a fundamental human need that is as fundamental as eating and breathing and sleeping. It's why, you know, Facebook is about to go public for $100 billion, because we need that sense of connection. The people don't have an extended family in most cases, or even a nuclear family. They don't have a job that feels secure, a church or synagogue they go to regularly, a neighborhood where they've lived their lives and know their neighbors. And these are not just things that affect the quality of our lives, they affect our survival. That study after study has shown that people who are lonely and depressed are 3 to 7, in some cases 10 times more likely to get sick and die prematurely than those who have a sense of love and connection and community. And I don't know anything in medicine that has that powerful an impact. In part because you're more likely to abuse yourself when you're depressed. I was profoundly depressed when I was in college to the point of being suicidal, so I understand depression is when you're seeing the world through kind of shit-colored glasses and everything looks bad and it'll always be bad. And, you know, anytime you thought things would be good, you were just fooling yourself. And so it really underlies a lot of the behaviors that people use to get through the day. You know, telling somebody who's lonely and depressed they're going to live longer if they just change their diet or quit smoking, it doesn't work, because people don't want to live long when they're depressed. You know, they're just waiting around for something bad to happen. You know, that's the way it was with me. And they say things like, I've got 20 friends in this pack of cigarettes, and they're always there for me, and nobody else is. You're going to take away my 20 friends? What are you going to give me? Or food fills the void, or fat coats my nerves and numbs the pain, or alcohol or other drugs numb the pain, or working all the time numbs the pain, or video games numb the pain. We have lots of ways of numbing and killing and distracting and bypassing literally and figuratively pain. But the pain is not the problem. The pain's the message where it's saying, hey, listen up, pay attention. You're not doing something that's in your best interest. And when we work at the level of the depression and the loneliness by creating these social networks that are so powerful for people, then we find they're much more likely to make and maintain lifestyle choices that are life-enhancing than the ones that are self-destructive. Information is important, but clearly it's not enough. If it were, nobody would smoke. Everybody knows it's not good for you. We have to work at a deeper level. Now, just to show you a few studies, and then I'll stop and we'll do some questions. This was a study that was done at Duke by Redford Williams, and they found that 6 months after a heart attack, those that were depressed, 16% were dead. Those that weren't, 4% were dead. A fourfold difference in mortality 6 months after a heart attack simply from being depressed, independent of their cholesterol, their blood pressure, the amount of damage to their heart, other factors like that. Now, I don't know anything in medicine that has that powerful a predictive value, and yet most doctors don't even ask their patients if they're depressed, because most doctors these days are depressed. And so we need to work at a deeper level to make this work. When you're depressed, your immune system is depressed, in all the ways that we can measure. And one study from Margaret Chesney at UCSF found that men and women who were HIV positive and who were depressed had more than double the likelihood of developing AIDS and dying from it than those who didn't. The First Lady of South Africa shared with me earlier that when people have diabetes, they're much more likely to get AIDS because, again, their immune systems are compromised. Well, what can we do about that? Well, David Spiegel did a classic study where he took women who had metastatic breast cancer, randomly divided them into two groups. They both got the same chemo and radiation and surgery, but in addition, one group of women met together for an hour and a half once a week in a supportive, nurturing environment to open up and talk about what was really going on in their lives. That sense of real human, deep, authentic connection, not just the superficial stuff. Did that for a year. 5 years later, he found those women lived twice as long as those who didn't, and that was the only difference. Now, a skeptic might say, oh, come on, give me a break. You mean sitting around with a bunch of people in a circle and talking about my feelings is going to double my survival in breast cancer? Please, but that's what it's shown. Because we are touchy-feely creatures. We are creatures of community. That's what's enabled us to exist as long as we have and to survive. And anything that creates intimacy is healing. Even the word healing comes from the root to make whole. The word yoga comes from the Sanskrit, to yoke, to unite, to bring together. These are very old ideas that we're rediscovering. And if you go to the essence of most spiritual traditions, once you get past all the rituals that people kill themselves over, what do you find? The same themes of altruism, forgiveness, and compassion and love. And why? Because that's what brings us together. That's what frees us from our suffering. In the very first study that I did when I was a medical student back in 1977, 35 years ago, I had 10 men and women with heart disease. One of them was a 75-year-old guy who hated gay people, and one of the other people was gay, of course, as these things go. And they started insulting each other, and one got chest pain because he got so angry and took a nitro. The other got chest pain, took a Demerol, slammed the door. I thought they were both going to have heart attacks and die, and this is going to be the end of my very short research career. But I talked to them privately. I said, look, you're giving the power to give you chest pain and maybe even a heart attack to the guy that you hate. That's not really smart. Again, we have to get past this, selfish and selfless. It's both. Because when you forgive somebody, when you are more altruistic to them, when you're more compassionate to them, which we taught them to do with each other, then it frees you from the suffering, as well as the other person. And so there's not a zero-sum game here where somebody wins and someone loses. Everybody wins when we can get back to these basic spiritual tenets that you find in all spiritual traditions that are so important. And that, to me, is what I love most about doing this work. It's not just unclogging arteries or shrinking tumors, as important as those things are, because, again, we're all going to die sometime. So to me, the more important issue is not simply how long we live, but how well we live, and how we can use the experience of suffering, both personal and social, as a doorway or as a catalyst for transforming our lives for the better. So I want to salute GBC and the work they're doing, and to you and for the opportunity to be here today. Thank you. People used to think I was pretty nutty. And it was met with a lot of resistance and a lot of first of all, nobody could ever do this, and even if they did, it wouldn't matter. Then it was like, well, your patients did it, but you live in California, it's an altered state, they'll do anything there. This will never play in Peoria. And then it's like, well, of course this works. Everybody knew that, And so we're kind of at the point now where, because of the Medicare coverage, it has really moved from the fringes into the mainstream. And so now we're in the process of training other physician offices, clinics, hospitals, and so on. From the Cleveland Clinic, we just finished training, to these very small practices in community hospitals. And so it's really, for me, the culmination of a life's work, and it's a beautiful thing to see. Thanks for your question. Time for one last question? Yes, sir. Wait, there's a microphone coming to you.
This is such a wonderful lecture I have ever heard, and thank you very much for that.
I appreciate that.
And maybe big round of applause for him.
Thank you.
One of the questions I had, this is such a simple way of overcoming multiple host of diseases. Now, are the medical schools empowered to give this kind of idea to the doctors so that it can make the next generation changes into their education, treatment, as well as to the patients?
The answer is yes. And again, I used to think if we just did good science, that would change medical practice and medical education. I was wrong. But if it's reimbursable, it affects everything. And it's not because doctors are only interested in money. They're not. Most people go into medicine because they want to make a difference in the world. But if you're trained to use drugs and surgery and you reimburse to use drugs and surgery, that's what you do. It's like the old Abraham Maslow. The only tool you have is a hammer. You tend to see everything as a nail. And now that we're creating ways that, primary care doctors are getting hammered economically, and many people are leaving the profession or not recommending their kids to go into it, we're really creating a new paradigm of medical care that's both more caring and compassionate, but it's also more cost-effective and competent, that can allow doctors to make more money by having a team of people they work with, not just a doctor, but a yoga teacher, an exercise physiologist, a dietitian, a psychologist, a nurse, and so on. They work together as a team, and so it's a way for doctors to get re-enchanted with medicine in a way that's very moving for them and for me, and I feel so privileged to be doing this work. So again, I'll be around this afternoon. If anybody has any questions, just come up to me, and I want to thank everyone again for the chance to be here today. Thank you.